Welcome everybody, with you Dr. Magdy Abdel, consultant of infectious disease, hepatology, and gastroenterology. Our topic today about chronic diarrhea in children. So, what is mean by chronic diarrhea? Diarrhea is when you have loose, watery stools several times a day. This condition generally goes away within a day or two without medical treatment. Diarrhea that continues for 4 weeks, even if it comes and goes, is considered to be chronic diarrhea. So, when diarrhea lasts for several days, it can lead to dehydration. Infants and young children are especially vulnerable to dehydration caused by diarrhea. During episodes of diarrhea, the body loses the fluids and electrolytes it needs to function correctly. Electrolytes are minerals that affect your muscle function, the amount of water in your body, and the acidity of your blood. So, it is very important to diagnose it, and also we have to know what are the causes of the condition. Diarrhea is also a major cause of malnutrition in children under age of 5 years. Many of these cases are due to contaminated water and food in developing countries. A child under the age of 3 is likely to have 3 episodes of diarrhea per year. Each incident deprives the child of nutrition needed for growth. Continued episodes of diarrhea can therefore cause malnutrition. Malnutrition can continue the cycle of diarrhea. Around the world, diarrhea is the second leading cause of death in children under age of 5 years. So, it is very important to know what are the causes of diarrhea. The cause of diarrhea in children is not always found. However, common causes include too much fruit or fruit juice, use of antibiotics or other medications in baby or breastfeeding mother, allergies or sensitivities to particular food, dietary changes in baby or breastfeeding mothers. Severe diarrhea can be caused by inflammatory bowel disease, bacterial infections, viral infections. Also, parasites can cause chronic diarrhea, especially Entamoeba histolytica and Giardia. Malnutrition also can cause chronic diarrhea. Improper food preparation, poor hygiene. Children visiting foreign countries, especially developing countries, are at risk of getting traveler diarrhea. This condition usually occurs when someone consumes contaminated water or food. What are the symptoms of diarrhea? Infants often produce loose stools, so this should not be immediate cause for concern. However, a sudden increase in watery stools, especially if they are accompanied by congestion or fever, may be a sign of diarrhea in infants and young children. Other symptoms include abdominal pain or cramping, nausea, urgency to use the bathroom or loss of bowel control, fever and chills, dehydration. So, what are the symptoms of dehydration? Dehydration is when the body no longer has enough fluids to work properly. In infants and young children, dehydration can progress rapidly It can lead to more serious health complications if it is not treated quickly. Complications of dehydration include shock, organ damage, and coma. Signs of dehydration include dry mouth, dry sunken eyes, sunken cheeks, no tears when crying, irritability, dry skin, fatigue. The following symptoms can indicate severe dehydration. More than 8 hours have passed without urination. Child is extremely listless. The soft spot on top of your infant's head, this is the fontanelle, appears sunken. Pinched skin does not spring back. High fever, unconsciousness. So, caring for your child at home. Treating your child at home is usually effective when they have a mild case of diarrhea. It is important to note that over-the-counter medications used to treat diarrhea in adults should not be given to infants or children. As regards, if you have a child and this child suffer from chronic diarrhea, so you can make sure your child drink plenty of fluids. Don't feed them foods that seem to trigger diarrhea. Wash your hands often, especially after each diaper change, to avoid spreading bacteria in the home. You should continue breastfeeding when your baby has the diarrhea. Breast milk can help ease symptoms of diarrhea and speed up recovery. Monitor your child carefully, looking for signs of dehydration. All this will prevent the complications and also will prevent dehydration. Change your child diaper immediately after bowel movement. This can help prevent diaper rash and irritation. Use water instead of wipes, which can further irritate the skin. Over-the-counter creams with zinc oxide can also help soothe and protect skin. So all these measures can help to prevent complications of diarrhea in your children. So it is very important to proper diagnosis and proper management of chronic diarrhea in children. Thank you very much.